us about the new educational program.
The new educational program for the kinesiotaping method starts from the superficial tissues and slowly through the program gets to influence deeper tissues.
What does that mean? Starts with EDF?
It starts with EDF, yes.
Okay.
So the most superficial stimulus to the body is to stimulate the epidermis, which is innervated but not vascularized.
So KT1 would start with that?
It starts with that, yes.
Wow.
So the idea being that tape works at the superficial tissues. So that's where we're going to start with the educational program. And then as we talk about deeper tissues and deeper influence, deeper stimulus, we will we will add to the program so that you'll get to those deeper stimulating applications.
Which is muscle inhibition and...
Right, so we were going to start with epidermis and then look at treating the dermis, looking at different ways to treat fascia, fascial limitations, and then muscle, then joint, so ligament and tendon, and finally circulation, because that comes from the deepest tissues to hydrate, to cleanse the more superficial tissues.
What else? What else is new? What about MDT?
MDT, manual direction testing. It is a way that we can be assured that our tape will have a positive effect before we put the tape on. There is MDT tissue, where we're looking at glide of tissue, decompression of tissue, and compression. So we will do with our hands what then we will be able to do with the tape. And we will have a better assessment process.
And a better success rate.
Exactly. So we don't have to try a piece of tape to find out if it will work. I'll test the muscle. I can glide the tissue proximally, and if that brings the muscle into a more normal function, then I know that gliding through the tape towards the proximal attachment will give us a better function.
What else?
What else? We have a lot more science in the program this time. We have a lot of parallel science, that which is more about how the skin actually functions, that the capillaries and the dermis feed the epidermis, and the epidermis is biologically alive. It's part of our sensory system and part of our immune system as well. We have studies about reducing shear in the tissues of the low back when tape is applied. We have some emerging science that suggests that we can get pain relief post-surgically that will decrease the need for opioids. It's an emerging program, but we're getting some really good results, statistically significant results, that people need less opioids after surgery because we can apply the tape.
And that's already in the education
That's in the program.
Very cool.
We have some emerging research about functional MRIs that suggest that the tape influences larger areas in the brain, or that the brain perceives the tape in a larger way, and even areas of the brain relative to perception, even the cerebellum, is excited by the presence of tape. And so we don't have a lot of the in-between data yet. We apply the tape and we know this happens, but we are getting closer and closer to understanding how the tape works.
When you coming to Russia?
I'm ready. I'm ready. So ready.
Thank you very much.
Thank you.